This episode is brought to you by Iams Pet Food. When you choose Iams dry dog or cat food, you can see a difference in your pet with your own eyes. Healthy energy in 5 days, healthy digestion in 10 days, and healthy skin and coat in just 25 days. Satisfaction for you and them. Guaranteed or your money back. Feed Iams dry dog or cat food and see a visible difference. Visit iams.com/difference to learn more.
The number one selling product of its kind with over 20 years of research and innovation. Botox Cosmetic, onabotulinum toxin A, is a prescription medicine used to temporarily make moderate to severe frown lines, crow's feet, and forehead lines look better in adults.
Effects of Botox Cosmetic may spread hours to weeks after injection, causing serious symptoms. Alert your doctor right away as difficulty swallowing, speaking, breathing, eye problems, or muscle weakness may be a sign of a life-threatening condition. Patients with these conditions before injection are at highest risk. Don't receive Botox Cosmetic if you have a skin infection. Side effects may include allergic reactions, injection site pain, headache, eyebrow and eyelid drooping, and eyelid swelling. Allergic reactions can include rash, welts, asthma symptoms, and dizziness. Tell your doctor about medical history, muscle or nerve conditions including ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, and medications, including botulinum toxins, as these may increase the risk of serious side effects. For full safety information, visit BotoxCosmetic.com or call 877-351-0300.
See for yourself at BotoxCosmetic.com.
Allergies in babies and children seem more common than ever. But what's the truth behind them? And what do we need to know and do as parents to keep our little ones safe? This week, I am joined by Dr. Helen, a specialist doctor in the field of allergies.
The trouble with allergy is it is an ever-evolving field. There are more and more things we're learning. So I've been a doctor nearly 20 years, and back at the beginning, some of the newer conditions, which we'll touch upon, we'd never heard of those. Even now, the more non-IgE allergy symptoms, which I think Alfie had, was not something we talked about in my childhood.
Having people like yourself is just absolutely golden. It's, the work that you do is just so important, Helen.
Because let's face it, if something happens and your baby reacts, at the end of the day, I'll figure it out.
Hello, I'm Pip, and welcome to the Midwife Pip podcast, the home of expert information and real chats on all things pregnancy, birth, and beyond. Allergies in babies and children seem more common than ever, but what's the truth behind them? And what do we need to know and do as parents to keep our little ones safe? This week, I am joined by Dr. Helen, a specialist doctor in the field of allergies. Helen became interested in allergy due to her own experiences of managing a child with milk and nut allergies, and now educates internationally on this important topic. So welcome, Helen, and thank you so much for joining me and Alfie, who is going to make an appearance, I have no doubt, in this podcast. Thank you so much for joining us today.
No problem. Pleasure to be here and share information.
I am so delighted that we've managed to pin you down, because I think you hear, don't you, as a expectant or a new parent, the term allergy, I think, instantly instills worry and fear in parents, because we think of allergies and we think of, massive emergencies and allergic reactions, and it's all very scary and clearly not a journey that anyone wants for them or their child. And I also feel like we're hearing so much more about allergies, and maybe that's increasing awareness, which is always a great thing, or maybe it is an actual increase in trends. What's your kind of take on allergies and that kind of rise, Helen?
Yeah, I totally identify with the anxiety that comes. And when I first had my son, Ethan, who is now 15, nearly 16, I was a GP trainee at the time. So I was still a doctor. I'd been a doctor for quite a few years. And the first time he had an allergic reaction was terrifying, because you can't help but your mind immediately go to worst case scenario and think, oh my goodness, he's going to have anaphylaxis and he's going to die. And that is where all of our brains go. And now, of course, having gone back to university, done another degree, specialised so that I could look after him better and then help others, I realised that actually that's not a common scenario. Anaphylaxis is actually quite common, but certainly dying, thank goodness, is a rare thing. But I remember ringing his dad at the time and saying, oh my goodness. And he was like, well, call an ambulance if it's that bad. And I remember saying, I don't know if it's that bad. I had nothing to pin it on. So even being a healthcare professional, I didn't really know what to do. So fully identify with how the kind of normal mums and dads out there with no medical background, and even many of us with medical background, still know nothing about allergy. So in terms of like your question, there is always that challenge when you are considering any disease of, is this just that we know more about it, we talk more about it? The wonderful nature of social media means it's on everyone's radar. And there is an element on that. But there was a study where my wonderful colleague, Paul Turner, looked at good data from GPs from 1998 to 2018. And what they did is they looked at everyone who was coded with a possible allergy, probable allergy, or probable with an adrenaline autoinjector. Now, that data's got lots of issues, as you can imagine, because it depends on somebody reliably assessing if this is allergy, which isn't always the case, but it's the best data we have. And it definitely did show that the incidence seemed to have doubled. So therefore, the number of new cases doubled, but has seemed to have plateaued. So it's become more stable over the last 4 years. So it's not continuing to rise, but we're now looking at around 4 to 5% of children with food allergies. So in a classroom, probably one or two, which is way more than when I was at school.
Yeah, definitely. And I think that's probably why we're also more aware of it, because we know
Yeah.
if we're not directly impacted, we've got a friend or a family member, or like you say, a sibling or someone at
Yeah.
school who's impacted. And therefore we're more anxious because we're more aware of it. And we end up in this kind of cycle, I suppose. Now, talk to me about, Helen, what you kind of perhaps experienced with your son and what parents need to look out for. How do we know if we are navigating an allergy? Because I think the spectrum of symptoms is vast as well, isn't it?
Yeah. And the symptoms have been defined by the National Institute for Clinical Excellence. They've defined them into skin, gut symptoms, and respiratory symptoms. But the trouble with allergy is it is an ever evolving field. There are more and more things we're learning. So I've been a doctor nearly 20 years, and back at the beginning, some of the newer conditions, which we'll touch upon, we'd never heard of those. Even now, the more non-IgE allergy symptoms, which I think Elfie had, was not something we talked about in my childhood. So the classic allergy is one called IgE mediated allergy. So it just refers to the immune cell immunoglobulin E that we all have in our body that traditionally was there to fight parasites. And that's the one that we would recognize. So let's say, we all know a peanut allergy. You have a peanut, within minutes to an hour, you might get hives, which is a nettle sting rash, swelling, tummy ache, vomit, runny nose, sneezy, and possible anaphylaxis, which is breathing difficulties, dizzy, collapse, coughing, voice change. And those are the only allergies we have so far that we can test for. Now, they come quickly and they also resolve usually within a few hours. So that, to be honest, is generally not an allergy that's missed because it's bland or obvious. Every time you eat a peanut, this happens. And hopefully someone's going to go, okay, something's happening here. Although, ironically, my mum, having listened to me lecture now, says, oh, you had an egg allergy when you were younger. So that allergic background that me and my children's dad have is why our children ended up with allergies. Thankfully, like many egg allergies, it's gone. Now, the harder allergy is a non-IgE allergy. So as that name implies, that doesn't involve that immunoglobulin E cell, but it still involves the immune system, and that's what makes it allergy. The symptoms tend to occur in infancy. So like classically about 8 to 12 weeks of life. You're not born with it, but it develops. And it's more common in a formula-fed baby because they're getting larger quantities of, say, cow's milk, where this is common, versus a breastfeeding mummy where less cow's milk goes into breast milk. But it definitely happens. My son had mixed non-IgE and IgE-mediated milk allergy. And they give symptoms 2 to 72 hours later of reflux, so back arching. They scream the livelong day down, very unsettled babies. You're nodding. Diarrhea, blood in the stool, maybe very red kind of nappy rash areas. Maybe constipation is coming more into that. Quite grunty, congested babies. And if they're on the severe end of disease, they might have growth issues. But you can have a very healthy seeming baby that's growing. My son was on the 99th centile, but still be very impacted, like still screaming the livelong day down, refluxing, miserable. And those families often find they're falsely reassured, like there's nothing wrong, this is normal because your baby's growing well. And that's not true. So there's like gut inflammation going on. And the only way of diagnosing that is having it on your radar, taking the food out for 2 to 4 weeks, see if it gets better. And then every parent hates me because I say, look, we do need to retry that food, because otherwise, sometimes you are barking up the wrong tree. And it was something else, funny 5 minutes, it settled. Has it really made a difference to your symptoms? So that's a delayed allergy. And then there are now rarer ones like
my brand new book, Midwife Pip's Guide to a Positive Birth, is now available. So much more than a book. This is a guide that allows me to hold your hand through your birth preparation journey. With over a decade of experience and knowledge packed in to ensure you really are empowered in the way you deserve to achieve a positive birth, regardless of the twists and turns that crop up. Make sure that you get your hands on Midwife Pip's Guide to a Positive Birth book now and are empowered to have the birth experience that you deserve.
FPIES, which is food protein-induced enterocolitis syndrome, where children get profuse vomiting 1 to 6 hours later, often to the point that they are floppy, lethargic, and end up in hospital. And that is a real life-threatening one that, again, you can't test for, but you don't want to miss it. So there's so much to know, so many nuances, so many things it crosses over with, like just I say straightforward eczema. Eczema is not straightforward, but like sometimes it's just eczema. Sometimes it is colic. There are so many other things in a baby that could be going on that you do sometimes need that real expert to tell you and guide you. So it's hard.
It's really hard, but I am so pleased. And I just want to emphasize what you just mentioned there, Helen, about the growth factor and babies being reassured, because that was us as well.
Yes.
In that it was like, well, he must be okay because he's gaining weight well. And when you're sat there knowing as a mum with that gut instinct that this isn't okay, it's really, really difficult. So I think, like you said, actually having that expertise is paramount, and actually not being afraid as a parent, if you think actually, no, I do need another opinion, no, I'm not comfortable with this, being comfortable being that advocate, which can be really hard, especially when you're feeling really vulnerable and sleep deprived, and it's so emotional seeing your child struggle, but actually knowing that it is okay to think, actually, no, I'm not happy with that answer.
It's really, and even us as health professionals find that very difficult, as you're not, to ask for another opinion. I mean, I was told to cut cow's milk out by a neonatologist because Ethan was on intensive care. He didn't tell me why. We were doing it for his skin. And I didn't really pay attention to the fact that suddenly this child slept and he didn't have bowel issues. So it wasn't on my radar. You do really need to ask for another opinion. And it's probably the best skill to learn as a parent early, that my mum has said to me, if you don't stand up for your children, no one else will. And I've taken that on. I mean, Ethan recently broke his arm, and I had to speak to 3 different people to convince them to x-ray him, because they were saying, no, it's not classical, blah, blah, blah. And I was like, yes, but he now can't straighten his arm. It's swollen. I know he's not in pain, but my son doesn't necessarily. So eventually I persuaded someone to x-ray it, and it's broken. And, so sometimes you do need to ask for another opinion until you at least have an explanation you can understand. Because it might not be that you come to see me and I say, yes, I agree with you, this is allergy. I might say, right, I think it's X, Y, and Z because, and then we work together to explore that. And the main thing I hear time and time again is, I finally feel like I've been heard. And that's so important. So yeah, do ask for another opinion, definitely.
Yeah, it's so important, isn't it? You're so, so right. And I guess one of the reasons why we want to get to the bottom of allergy, not allergy, what's going on with our children, is because we then want to explore support and treatment and to make everyone's lives easier. Talk to me about what kind of support and treatment is available to parents if they are suspecting or navigating an allergy.
So I think when it comes to allergies, the biggest challenge we have within the NHS is that we have far too few specialists. So I think Allergy UK did some data, so they're a big allergy charity, showing that if you look at like how many diabetic specialists there are to people with diabetes, there's lots, and versus allergy for children is something like 1 per 300,000 people, and even higher numbers for an adult allergist. So basically, and Paul Turner's data showed that 95% of people with a diagnosed allergy never see a specialist, which is phenomenal. So if you can't get a referral, you can't get help, and that is, I'm really sorry to say, a postcode lottery, then Allergy UK, Anaphylaxis UK are big allergy charities. I work for Anaphylaxis UK. I'm their trustee. There are helplines on there, loads of useful information sheets, and definitely link in with them if you need to. The NICE guidelines say if you have a confirmed non-IgE allergy, so the one we were saying with the baby's upset, etc., that really you should be allowed to see a dietitian. So you're within your rights to ask for one. The challenge is they are few and far between, particularly expert ones. And for immediate IgE allergies, it comes a little bit too, it depends on the food. So these days, egg allergy, unless it's been a very severe reaction, they would tend to give you information about how and when to introduce this at home, but not necessarily see people, because it is, if I can say it, one of the milder allergies and tends to be outgrown. But if you are gathering multiple allergies, strong history, terrible eczema, you need a referral to somebody who's specialised in allergy. And it's asking the GP. And do not be, for want of a better word, fobbed off with that we don't do allergy testing on the NHS. I hear that so often. It's just a blatant lie. Yes, we do. I know I'm private now, but I've worked in NHS services for allergy for 5 years. We absolutely still all have centres that will do allergy testing for children and adults.
A quick pause here because I want to share a super important health tip from Nutricia, the sponsor of this week's episode. The first 1,000 days of your child's life, which is the 9 months of pregnancy and up to their second birthday, provide an incredible opportunity to support their gut health, which has a profound impact on all sorts of short and long-term health outcomes. Which means, as a pregnant or new mum listener, you are in an incredible time of opportunity. So here is a top tip. Having skin to skin with your baby, regardless of how you are feeding them, especially in the first few hours and days of life, helps to support the initial colonization of your baby's microbiome, as the bacteria present on your skin transfers to your baby's skin during skin-to-skin contact, colonizing your baby's skin and giving you the opportunity to pass good bacteria to them. Gut health matters for so many physical, developmental, and psychological health outcomes for our children. So here is to us helping them on their way to healthier, happier futures. That's really good, Chef. Thank you for sharing that so honestly, Helen, because yeah, I mean, that will be something that so many parents will hear. And again, it comes back to that being like, well, if that's the best next step and that's not available, why not? Like, why is that not available? Yeah. My goodness, Helen, our, I love the NHS. I practice in it, but it's so stretched and so under-resourced, as you just said. There's great individuals, but they're in a system that doesn't allow them to do what they want to do. Our NHS follow-up for Alfie was an invitation to like a group webinar, which I'm sure would have been really helpful. But unfortunately, it was a day where I also had my toddler and I couldn't attend. So I then just got a letter saying because I hadn't attended, I'd been discharged.
Yeah.
That was our follow-up. And I was like, oh my goodness. It's not like I've DNA'd an appointment. It was just a workshop on a given day that I couldn't attend. And that's it. So yeah, it's so difficult, isn't it? Because we are in this space where, it's clinicians are challenged and stretched, but when it's your child, that's just not your problem, is it? Like, we still want the best for our children.
Of course we want the best. And the thing that happens, particularly with the delayed allergies, is, we talk about trying to reintroduce them eventually with ladders. So ladders are particularly for milk and egg, where you start off with it in a wheat matrix. And by doing that, it unfolds the allergen, the thing you're allergic to, and makes some children less reactive. So they might tolerate, for example, biscuits with milk in or cake with egg in, but not pure egg or pure milk. But ladders have like a lot of issues around. They're like, well, how much do you give? And how often do you give it? And if they're teething, how do I know the symptoms of teething and not the allergy coming back? And so, in my experience, the children with genuine allergies often that their family struggle to know how to analyze all of these. You need a lot of support, and GPs on the whole, unless you've subspecialized like me, don't know this stuff, because when I come and lecture my GP colleagues, I have time to tell them what's allergy look like and how to test and who to refer to. I don't have time to sit and talk to you all about ladders, which really is a dietitian's expertise, and I have a dietitian that works with me on an online group that we support. And I would be lost without them, because if you're going to ask me how much milk protein is in a pancake, I have no idea. But I know a lady who does.
Yeah,
or
and
a
that's
man.
the network. That's what you need, isn't it?
Yeah.
Well, none of us are going to be specialists in every area. You know,
No,
that's
you
why
need a whole team.
Yeah,
And
100%.
allergy clinics, the best allergy clinics have psychologists because of the impact this has on everyone's mental health. And that also can trigger allergy reactions. Dermatologists often, dietitians, and the allergist. And we have an online membership where people pay a subscription. And in that, it very quickly became apparent to me, I needed all these people. So, they would be asking me, well, what do I do about this ladder? And I can tell you a bit about, do I think it's a reaction, how to navigate it? But all the nuanced questions around what's this shop or alternative, didn't have a clue. So we quickly started asking real specialists to support us in that journey. And the best allergy centres have got those. And when you're in a centre, invariably my patients tell me like they're amazing. But you still have this in between appointments, like 1 to 2 to 3 years, who do you call? Really hard. I think allergies are, people with allergies, the most poorly served of many of our medical conditions within the UK, which is just totally unfair.
Yeah, and I, to be honest, was completely naive to the whole thing.
Yeah.
Completely naive until I found myself slap bang in the middle of navigating it. And my kind of first line advice was, so I was breastfeeding Alfie, and thankfully still am, but the first thing was like, well, it's probably not sustainable from a dietary perspective. And I was like, no, but this is really important to me. When he had meningitis when he was 5 weeks, and I was very much like, the best thing I can do is maintain my milk supply so I can support his gut health afterwards. I was like, there's no way I'm now just going to throw that away. But it was really, I almost had to advocate just for my infant feeding choice at that point. And I'm quite confident with having that voice. But I thought for parents that haven't, that again, it's just so multifactorial. And one of the things that I've definitely questioned and thought about, and I'm sure lots of allergy parents have, is there anything we can do, Helen, especially in pregnancy or in the conception period, to try and reduce our children's chance of allergies? Because obviously with all things like this, prevention is better than cure when that's an option.
Yeah, and absolutely, that's the question that all of us think. As soon as you're thrown into the allergy world, and I was the same, like, I know I was an allergic background, but I hadn't vaguely considered my children would have allergies, which now seems stupid, but it just was what it was. And so when I was doing my medical degree, my second time with an allergy, I was very heavily pregnant with my third. And that was my main question. How can I make sure this baby doesn't have allergies? Because God forbid it's got different food allergies to what we're already navigating. And my middle one has eczema and environmental allergies. And at the time, this is advice now we don't follow, it was maybe if we moisturize from birth, we might prevent allergies forming, because we know children with eczema have higher risk of allergies because it can cross into their skin barrier. And that was based on a small sample study. But when they actually did a big research study looking into that, they actually found it increases children's risk of allergy forming because we transfer food proteins across from our hands when we're handling and moisturizing. And that's why we don't use coconut oils, oat-based oils, foods that in the creams before they're weaning, because you can expose your baby to it through a skin barrier. That's an abnormal way for the body to process it, and allergies form. So obviously, if your child's got eczema, you do need to moisturize, but wash your hands first. But if your baby didn't, you would just leave it be. So basically, no, there is not really anything much you can do. There's a little bit around fish oil supplements for mums, but not great evidence that would prevent allergy forming. We know that if you are able to have a vaginal delivery, that probably helps in part. And I'm always a massive stressor is we have enough mum guilt. Like, you cannot take forward what I'm saying as a guilt thing, okay? Because there are some things that we know affect the gut flora, cesareans, early antibiotics in life, perhaps formula feeding, but they are not the whole story. So genetics is probably the biggest factor, but I have babies who no genetics, vaginal delivery, breastfed, no antibiotics, covered in eczema and allergies. There is, as we said, multifactorial. There's more to it, but those are components. But ultimately, if someone says you need a cesarean to save your child's life, go with that. We can sort the allergies out. That your child will still be alive. I can teach you how to live well. But those are things. But really, is there much you can do? No. There is stuff now around early weaning. I don't know if you've heard about that for children with allergies. And that particularly is for what we would say high risk babies. So really it's children with eczema, babies with eczema. But I do have families who have a lot of allergy in the family and so want to do everything they can. So we say from the age of 17 weeks, and this is outside NHS guidelines for weaning, which is 6 months, but it is still fine to do. If your baby can hold up its head and has lost the tongue thrust where it's pushing everything out, consider weaning early, particularly with peanut butter. Start small, increasing amounts, because we've extrapolated data that feels like we will massively reduce the risk of peanut allergy forming if you get it in there early. And there's good data about that from the Learning Early About Peanut study for those. They did that before the age of 10 months, and it reduced their risk of allergy from 35% to 10% if you gave the equivalent of a heaped teaspoon of peanut butter 3 times a week until the age of 5. That information only comes for egg and peanut. There's nothing else where we've been able to prove it makes a difference.
That is really interesting. And actually, that's an avenue that we've taken with the kind of slightly early weaning, especially around the peanuts. And again, I think it's difficult, isn't it? Because when parents start searching the internet, because where else do you go for weaning advice? Where people go now? Where is this support mechanism around such a massive, terrifying milestone? This stuff isn't readily available, and it's conflicting, and it's
very conflicting,
non-expert based, and it's really, really challenging. So I think, having people like yourself is just absolutely golden. It's, the work that you do is just so important, Helen, getting those messages out to parents.
Yeah, and it is really difficult. I mean, I set up a free Facebook group that people can join because I was seeing how poor the information was out there, and how we all go on social media groups about all sorts of things that we're looking at, don't we? And people are well-meaning, but they try to give you the advice they've been told, which isn't always accurate, actually, because you may not have seen someone who specialized in allergy, or it's inaccurate for that situation. So I set up a group to try and go in and navigate these people struggling. But even within that, then I will have other health professionals argue with me saying that, no, we don't advise weaning. And I'm like, no, you're right. We don't for the bulk of people, but actually early weaning hasn't been shown that it's going to damage their gut, despite what you're saying. And this information comes from, it's that BSACI, which is the British Society of Allergy and Clinical Immunology. So if you Google BSACI early weaning, you'll find the information pack around it. And on those boards are professors, expert dietitians, we're not going to be advising things that aren't safe. And it's not for everyone. And I would also say that even if you have a strong family history of allergy, if your child is not ready and isn't going to be ready to eat that quantity, all you'll actually do is stress yourself out massively. And I've seen this. So take it on an individual basis. But it's good to know, because it might change that pathway for someone.
Definitely. And in terms of weaning allergies, for the general population, the general baby, would you recommend sticking with that 6 months and then just having some specialist guidance for those at higher risk? Or is there any other way that you would advise kind of the best approach, I suppose, to weaning those allergies?
I mean, I think it's important to remember that when we were looking at the weaning from 17 weeks, the research study for the peanut actually didn't start at that age, but they extrapolated data saying that at that point, no one had a positive allergy test. So they sort of hypothesized that therefore, perhaps if the whole population started with peanut early, we would show a change. given that I don't think, it's still only 4 to 5% of children that have food allergies, not all of us. And there are lots of other issues that come along with it. For me, I would say for the average person without this strongly on your radar, wean at 6 months when the child really is ready, because there's got to be a developmental stage. But do think about getting peanuts in, because that is important for all of us, actually. So peanut butter because of choking. And don't stress about, I must give one allergen every 3 days. That we don't recommend that for most people, because you'll massively reduce how many foods you're exposing your baby to, which is the bit that is actually really important for our gut. We need a variety of fruit, veg, nuts, seeds, fish to expand our gut flora and have a happy bacteria that's relevant, not just for allergies, but all of our health. We are seeing this more and more important now.
That's a lovely message, because I've definitely been more cautious with like, right, well, we've had egg today, so let me keep all the other things quite samey. So I love that approach of like, it's almost a bit like, go for it, isn't it? In a safe and measured way, but you kind of got to go for it.
Because let's face it, if something happens and your baby reacts, at the end of the day, I'll figure it out. Like if you happen to have given salmon and sesame and peanut, and then there's an allergic reaction, and we're going, well, which is it? It's okay, I can do a test. I can figure that out if I have to. It's really only then where I've maybe got a child who's reacted to some bits, I might go, okay, for the bigger allergens like sesame or cashew or prawn, perhaps we'll try this on its own with other foods that you've already eaten every day for a few days. And the why for the few days, because sometimes you don't react on the first time, it's like 3 or 4 times later. Or babies with very sensitive guts, we might have to slow things down. But for the majority of the population, just try and enjoy it. Life is stressful enough, and in the mess, that is stressful enough for me. But we can sort this out with you if we need to. We can step back, but choose the way you want to wean and then go forward from there, I would say.
Definitely. And Helen, what's the name of your Facebook community group? How can people access that if they're thinking like, actually, I just need to know there's something else on standby, and if we crop up with a herd, do I want to be able to access this?
You can start, So,
doctor.
So most of my branding is Dr. Helen Allergy. So if you look at that, you'll find me on Instagram and Facebook, but it's Allergy Support Group with Dr. Helen Allergy. And we do a live every month where you can come and ask questions. That's free. And then the membership is where if you want a one-to-one with me and that daily support, because this is your life and you're struggling, you don't need to be. And the other nice thing is, because we recognize not all of us have got finances free to spend on these different things we do. We work with Sadie Bristow Foundation, who are a charity, to give bursary places into the membership for people that need 3 months support outside of their NHS clinics. Then you can apply for the bursary and be supported that way. Because we don't want people struggling on their own. And I don't want money to be the only factor there for that.
Oh, Helen, you're such an incredible human. Now, everyone that comes on the podcast, I ask for 3 top tips. And I wonder if you could share your 3 top tips with us around whether that is, pregnant mums that are thinking, oh my goodness, don't know what to do, or those that are in the depths of allergies. But what would your top tips be, Helen?
I was thinking about them. I think we've touched upon some of them. So first of all, don't be afraid to give food. Okay. Because I think people get stuck in I just can't do it. And there's always some support. Health visitors are amazing. They might be able to come out and sit with you if you're really nervous. But if you start small and increase slowly, we all know deaths happen because it hits the media, but they are very rare, around 10 food allergy deaths a year in the UK. So, and the lowest risk groups are children under 1. It's very, 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 very rare, almost has never happened. So do just start and give that protection. Ask for help and a second opinion. That's my top tip number 2. Go to your receptionist in the GP surgery and say, who is the doctor who knows most about allergies? And then book in with them. There will always be who knows the most about skin, hearts, legs, whatever you need to know. Don't come to me about legs and arms, but come to me about allergies. It's fine. And then my third one is really to only consider early weaning if it is right for you and your child, and don't be pressured by anything else you see online. So there's no right or wrong.
Yeah, that's so powerful, because honestly, online, whether it's like you say, those peers that are trying to give information about their experience, or the good old mother-in-laws, We all know that advice.
Yeah.
Or experts that really aren't experts or out of date. It's a disempowering place sometimes, the online space, isn't it? Unless you know exactly who you're following has those credentials. So amazing that you're doing all the work you're doing. I could talk to you all day about this, Helen. I'm honestly, because I've had the personal experience, I'm now so interested in it all. I just think it's fascinating. And I've clearly got so much to learn, but thank you so much for taking the time to help us kind of get some of that base understanding. And if you're listening and you're like, yes, this is something I'm worried about, or I need more information, or actually I think this is what's going on for me and my baby, then do check out all of Dr. Helen's work, because like we've kind of alluded to today, you need real expertise. We're bespoke individuals. No child's allergy journey is going to be the same as another. So you kind of deserve that real kind of bespoke input. So thank you so much, Helen.
That's okay. Anytime.
Before I head off, I need to tell you something. 68% of you who listen to my show have not hit the subscribe button. So can you do me a favor? And if you've ever enjoyed listening, hit subscribe now. It makes a huge difference, helping me to keep bringing you episodes. And together, we can then reach and empower more women on this journey. If you are a pregnant or newly postpartum listener and are looking to have the healthiest, most positive and informed journey, then my exclusive Your Pregnancy and Your Postnatal Journey courses may be for you. I work with a select number of women in a bespoke way, with unlimited access to me and my expert team for the most transformative level of support at this important time in your life. We only get one shot at getting this time right. So to get in touch and find out more, head to midwifepip.com.
Hi, I'm Sam Baker and welcome to The Shift, the podcast that aims to tell the no-holds-barred truth about being a woman post-40.
Anyone that's worried about turning 40, I say hurry up and get here. This is where the party is. This is the good place.
Created and hosted by me, journalist and author Sam Baker. I started The Shift because I was so tired of the absence of older women's voices.
3 little injections around my eyes and suddenly I was like, oh, I just got the last year back. I'm not trying to look 30. I just want to look 42.
Where had all the women over 40 gone?
Nobody ever gets addicted to kale. You get addicted to things that kill you.
So I created The Shift to make a space to talk about everything from life, love, sex, to careers, confidence, mental health, menopause.
So, seriously, if you want to walk about in your pyjamas for the rest of your life, we're invisible.
Each episode I speak to an inspiring woman about her shift, the second half of our lives.
I feel very strong and think I genuinely don't care what anybody thinks of me. And that does come with age.
Join me every Tuesday, wherever you listen to your podcasts.